Thank you. It's a pleasure to be here. I'm going to talk about food insecurity. It's not a message of hope. And to get started, I want you to know what I'm talking about. Food insecurity is a term that we use to refer to inadequate or insecure access to food because of financial constraints. The popular image of that is food banks, but what I'm showing you here is a summary of 18 questions that for the last decade have been included on the Canadian Community Health Survey to measure this problem in Canada. I'm showing you this summary because I really want you to know what I'm talking about. The questions range from asking people if they ever worried in the last year about running out of food and not having money to buy more. And then there are some questions about not being able to feed themselves and their children balanced meals because of a lack of food or money for food. And then there are a whole lot of questions that ask about quantitative deprivation. People skipping meals, cutting the size of meals, going hungry without eating, and at its most extreme, going whole days without eating, all because of a lack of money for food. The reason the clause at this side is because of a lack of money for food is because that's how we typically get food in Canada, we buy it. So that clause is there to make sure we're not picking up people that have got mobility issues or are voluntarily depriving themselves of food because perhaps they're on a diet. The questions differentiate between the experiences of adults and children because of an abundance of research that shows when families are trying to cope with limited resources, adults will often deprive themselves of food as a way to free up scarce resources for their children. Sadly, that is turning out to also be true for teenagers, but the instrument hasn't been updated to pick that part up. Here are the results we have for the 4 years for which we have nationally representative data. What you can see is an increase. The problem over those years has gotten worse. In 2012, 12.6% of Canadian households reported yes to at least one of those 18 questions. That's, to translate it into more usable language for you, that's over 4 million people living in households affected by some level of food insecurity. The bars are graded here to show you levels of severity. That 4 million has to be an underestimate because the Canadian Community Health Survey isn't administered on reserves, nor is it given to people who are homeless, nor is it given to people on armed forces bases. So we have to be underestimating it with 4 million. There is profound geographic variation in this problem. Very, very high rates of food insecurity are recorded in Nunavut, always, and in the Northern Territories. Also, we see higher rates of food insecurity in the maritime provinces, but nowhere in Canada does the rate ever fall even below 10%. Because families with children are more at risk of food insecurity in our country, the exposure of children to food insecurity is even higher. By our best estimate, 1 in 6 Canadian children lives in a household that through this 12-month period will be affected by some level of food insecurity. In Nunavut, that rises to almost 2 out of 3. I've been showing you data from 2012 because in 2013 and 14, that 18-item module was optional, and not all jurisdictions chose to measure food insecurity. So the areas in white here opted out. Just to give you a feel, though, for what the trend is looking like as we go forward with the jurisdictions that did opt in, and I should mention they comprise about 82% of the population, you can see that there's a very slight decrease in 2014. That is not statistically significant, and we actually have no jurisdiction in Canada, of the ones who chose to measure the problem in the last couple of years, we have no jurisdiction in Canada that has marked a significant decrease. Nunavut, in case you're wondering, has gone up. Why does it matter? It matters because this is a very, very serious indicator of health problems. People who are in food insecure situations are much more likely to have been diagnosed with a whole range of chronic physical and mental health conditions. And that is true across the life cycle. At any point in time, if we sample people and we identify that they are food insecure, anything we ask them about their health, whether it's their teeth, whether it's their arthritis, asthma, diabetes, cancer, you name it. Anything we ask, we will get a significant effect for, and it will be graded by severity of food insecurity. Also, people who are food insecure are less able to manage their health conditions, and so they are more likely to have poor disease outcomes and to have negative, extreme negative effects. Another way of looking at that problem is this. These are the healthcare dollars spent on Ontario adults over a 12-month period for which their food insecurity was measured. Across the full spectrum of healthcare utilization, we can see significant trends with higher use, with more severe food insecurity. We have done multivariate analysis taking into account other things that you would imagine to go with healthcare utilization like age, income, education. Those diminish this gradient a little bit, but still people in severely food insecure households have more than double the healthcare dollars spending over a 12-month period. What's our primary response to this problem? Well, our primary response continues to be food charity. When we look at the public policies that have been introduced in this country in the name of hunger or food insecurity, they fall into one category and one category only. They have been public policy initiatives to support food bank donations, or they've been public policy interventions to further support the charitable activity. What's wrong with that? Food banks don't solve this problem. They don't even touch most of it. Here you see the numbers of people living in food insecure households over those 4 years for which we have nationally representative data. And next to them are those green cylinders, which are the number of people reported to be using food banks. Most Canadians who are food insecure don't use food banks, and those who do are not rendered food insecure. So from a public policy perspective, this is a very bad idea. If we wanted a better idea, we have some. There has been now more than a decade of monitoring. We have an enormous amount of information about who is food insecure and what drives this problem. On this graph, you can see the relationship between food insecurity and household income that has been adjusted now for household size. That's our single best predictor of vulnerability. But what you can see is it's imperfect. As income falls, the probability of food insecurity rises. But even at very low levels of income, we never get to a point where 100% of households are food insecure. How come? Well, it's taken us a long time to figure this out, and we think it's because food insecurity is actually an even better measure of material deprivation than income is. By the time somebody is struggling to put food on the table for themselves and their family, what we're capturing is the product of their income, their assets, their savings, their expenditures, and their debt. Those things together are what create this problem. A way to get a handle on the social policy implications or underpinnings of this problem is this slide. Here we've taken the population of respondents for 2014 and divided them up by main source of income. At the left end of this graph, you can see the rate of food insecurity for Canadian seniors, people whose households report their primary source of income being seniors' incomes, so pensions or retirement funds. Seniors have the lowest rate of food insecurity in the country. When we run any sort of analysis to look at this problem by sociodemographic variables, to be a senior is to be protected. Why? Because seniors receive a guaranteed annual income that is indexed to inflation. At the point when a low-income adult in this country turns 65, just by having a birthday, a 65th birthday, if they live that long, their risk of food insecurity will drop in half. That's a statement on the social protection that we offer to seniors. The other end of this spectrum is also a statement on our ideas about social protection. People on social assistance, about 2/3 of them nationally are food insecure, although the rates vary across jurisdictions because this is a provincially and territorially administered program. But to be on social assistance and welfare in particular is to be very, very likely to be food insecure. However, that is a function of social policy. Here you see the rates of food insecurity amongst people receiving social assistance in the province of Newfoundland and Labrador over a period of years from 2007 through 2012. In 2006, Newfoundland and Labrador began to roll out a poverty reduction strategy, but it was unlike any poverty reduction strategy that any other province has actually implemented. Why? Because it wasn't just trying to move some number of people above some arbitrary income threshold to make some report on a reduction in poverty. It actually was also trying to get at the depth of poverty. So social assistance recipients noticed all kinds of changes. Their benefit levels were increased, they were indexed to inflation, their liquid asset exemptions were increased, their earnings exemptions were increased. So the material circumstances of social assistance recipients over this period of observation got better. And what happened? They were more able to feed themselves and their children. So the rate of food insecurity dropped almost in half. I show you this because it is our single best example of the sensitivity of food insecurity to social policy interventions in this country, and it's a powerful example. But I would be remiss if I didn't show you this as well. Here's 2014 again, but main source of income is expressed in a little bit different way. In this pie graph, what you're looking at is the distribution of food insecurity by main source of income. So I've talked about seniors and I've talked about people on social assistance, but the majority of people who are food insecure in this country are neither. They're in the workforce. 62% of food insecure households in Canada, and this statistic has remained fairly stable over the period for which we've been monitoring, 62% are reporting their main source of income as salaries or wages. So this complicates the story in terms of thinking about policy intervention, because it isn't enough for us to do what Newfoundland and Labrador did with their social assistance programs, nor is it enough for us to wait for everybody to turn 65. The last slide, then, is, well, I'll just settle down here now and reflect on this last slide for the next 4 minutes. And the last slide is another iteration. I so rarely get anybody keeping time. It's such an enlightening thing. This is the same graph I showed you earlier, except now we have divided it by levels of severity. And so what you can see is the most extreme levels of food insecurity, severe food insecurity, and moderate food insecurity rise much more sharply with low incomes. That's a very important thing for us to know, because we also know that those are the conditions that are most toxic to health. Everything that we've been able to do with the blessing of our funding and proof has pointed us to this end of the continuum. To deal with food insecurity in this country, we don't need more public policies that support donations to food banks by food industry or the delivery of food waste to food banks. We don't need any more of that. What we need is policy that tackles the bottom end of the spectrum. And that's what both the interventions that we're doing for seniors and the thing that Newfoundland and Labrador did for social assistance recipients, that's what both of those things were doing, was changing the circumstances of people at the very bottom end of the income spectrum. Going forward and thinking about intelligent public policy to tackle food insecurity, which I would argue is a very extreme measure and marker of health inequity in our country, we need interventions that target that bottom end of the income distribution. Thank you.